many of you know who have been to our practice before, we focus on not only the major surgical procedures, but also the non-surgical types of treatments that can help maintain the results of our surgery, but also intervene at an earlier part in the aging process to prevent some forms of aging from occurring. And one of the most common treatments that we perform is the worldwide use of neuromodulators, such as the use of Botox. Botox has been used in our practice since the early 1990s, and indeed we were one of the first practices to use this product to help reduce unwanted facial expression lines. So Botox comes in just a small little bottle which is reconstituted and then is placed in these small little diabetic needles and then can be applied to various parts of the face. And indeed now we can also treat areas on the neck and other parts of the body. So a neuromodulator is an important basis of our non-surgical practice because it can give an immediate type of result that removes unwanted frown lines, particularly in the forehead, around the sides of the eyes, and into the neck. But we know that Botox by itself is not the sole answer. We have to take a more comprehensive approach on what we can do to maintain the quality of the skin, whether we're talking about a loss of collagen or hyaluronic acid or elastin in our skin, which makes our skin spring back to our face. We also pay attention to the fact that as we age, we do tend to lose a little bit of volume in our faces, which is involved not only with collagen, but also subcutaneous fat. So there's been a lot of information about the use of fillers out there, and these types of fillers are all FDA-approved treatments that basically use hyaluronic acid as a filler to replace loss of collagen and fat. And when done appropriately, they work really well. Now, we always want to keep a natural type of result, so one of the unique things about our practice is that we strive to restore patients back to the way they were. We're not looking to distort or change things in a dramatic fashion. So when fillers are used appropriately, they can give a very nice result. We also now have the ability to use biostimulating types of products, such as the use of polylactic acid, as you see here, as well as calcium hydroxyapatite. These are things that stimulate more of your body to make its own collagen. And so if we use a neuromodulator combined with appropriate fillers and then use an energy-based type of technology to further enhance your collagen, we can actually prevent the form of aging that occurs in all of us, not only from sun damage, but just the aging process in general. And paramount to our non-surgical plan is to make sure that we have a good skincare plan, which forms the basis of using a good sunblock, adding vitamin C and vitamin A, as well as some of the other growth factors that we have. And so one of the unique things about our non-surgical practice here in the Bay Area is that we combine our European-style estheticians who have more than 20 years of experience to not only enhance those types of products on the skin and customize them for each individual. So having a good skincare program is very important, and then when we combine that with the appropriate use of some of these types of products, we can maintain a very youthful appearance. And then when it comes to the point of some patients who have just such a significant amount of aging, then we talk about the introduction of some of our energy-based devices, which we'll delve into shortly.